Hello, welcome to our presentation for lasers for periodontal use, presented by myself, Ash, Shauna, Ali, and Kamal.
Hi. So, what does laser therapy mean? First of all, let's know the full form of laser. L means light, A stands for amplification, S stimulated, E emission, R radiation. It's light amplification, stimulated emission, radiations. So, moving forward, what topics we are going to discuss today are what is laser therapy, how laser therapy works, what are the risks and what are the benefits of it, and post therapy dental care. So, what is laser therapy? It is a concentrated light energy, that is laser, which is used to perform various surgical procedures with minimal discomfort. The amount of frequency or wavelength of light is absorbed in the target tissue to treat it. Depending on the frequency of the laser, it can be used therapeutically or surgically.
So, how it works is that it's used in conjunction with other dental therapies. The periodontist will use a laser and will remove the inflamed gum around the tooth's root. They'll remove the tartar and the plaque buildup below and under the gum line. The next step is they'll use a tool to smoothen out any rough spots on the tooth below. This helps with reducing the risks of the teeth and the gums from gathering more bacteria and developing future infections. Now we're going to show you a video demonstrating how the laser is used. This is the video animation of the FDA cleared periodontal procedure called LANAP, an acronym for Laser Assisted New Attachment Procedure. The fiber optic tip is gently placed at the top of the periodontal pocket to begin removal of diseased tissue that lines the pocket. This is where bacteria live and build a neighborhood of its own that destroys healthy gum tissue and bone that holds your teeth in their proper position. There are specific germs and bacteria that cause gum disease. The Perio laser is designed to target and eliminate selectively only the diseased tissue and germs, dissolving toxins and leaving the healthy tissue unharmed. The laser tip is then removed from the pocket and set aside. In the next step of the procedure, ultrasonic cleaners as small as a laser fiber tip are used to remove the hard deposits we call tartar or calculus from the top of the teeth and roots. These instruments use sound waves to vibrate and break apart the hard mineral calcium deposits, with water flushing away the debris and cooling the instrument tip. Some hand cleaning instruments may be used at this time to remove any remaining hard calcium deposits. Then the laser is used again at the bottom of the pocket to remove any remaining diseased tissue. This pass of the laser also sterilizes the tissue and bone and completely eliminates the bad bacteria, germs, and toxins. It also stimulates the formation of a blood clot, which once formed contains fibers that reattach your tissue to the tooth surface and seal out debris and bacteria like stitches would, and creates the right environment to cause the bone and other soft tissues lost from the disease to grow back. Some of the properties of the laser is a monochromatic. This is the laser light that covers a narrow range of wavelength or frequencies. Coherence is that the electron transition happens at a specific time, but all of the photons emitted in the laser will have the same energy, frequency, and wavelength. This is why the light waves have a single wavelength or color. The high intensity is that the laser light spreads in a small area and in a small wave length. This is why laser light has a greater intensity when it's compared to just an ordinary light. Directionality is that the laser light is only in one direction, making it easier to not damage any other tissues around.
With the use of laser therapy, there are some risks. Some of the risks being eye injuries from not wearing proper PPE during the procedure, delayed healing because of uncontrolled diabetes or factors like smoking, burns and thermal damage, poor oral hygiene, or smoking and alcohol use. Who should consider laser therapy? Patients with periodontal disease, anyone requiring gum reshaping, those needing a frenectomy to remove oral lesions or ulcers, and patients on blood thinners, as using a laser will help cauterize the tissues while the procedure is being done.
There are many different types of lasers, some a little bit more common and have been used throughout the history of periodontal disease with great success. Some are new and a little bit more cutting edge technology, and they do require a little bit more research to be done before they become, I think, more mainstream. Now we're just going to watch another video on LANAP that's a little bit more in detail what you might see from a hygienist perspective.
Welcome back to MediClass. LANAP, or the laser-assisted new attachment procedure. The ultimate goal of reconstructive periodontal surgery is to achieve regeneration of periodontal structure. Periodontal regeneration involves the formation of new cementum, formation of new alveolar bone, and functionally aligned periodontal ligament. New attachment is another healing outcome of the reconstructive periodontal surgeries. It is the embedding of new periodontal ligament fibers into new cementum and attachment of epithelium to a tooth previously denuded by disease. This image represents the presence of subgingival calculus leading to formation of pocket, periodontal ligament loss, and alveolar bone loss. New attachment involves reduction of pocket and attachment of connective tissue fibers and epithelium onto the previously denuded tooth surface. Advances in periodontal therapy has led to the formation of new procedures that are less invasive, more effective, less painful, and cause minimal post-operative discomfort to the patient. Laser-assisted new attachment procedure, or LANAP, is one such procedure that allows healing by regeneration and new attachment. LANAP is a minimally invasive periodontal surgery protocol that uses neodymium-doped yttrium aluminum garnet, or the NDYAG laser. It uses a Perio MVP7 digital dental laser. It is a pulse laser and has a wavelength of 1064 nanometers. The concept of LANAP is it promotes self-regeneration of the lost attachment and osseous structures. It causes disinfection of the tooth and implant surface. It helps in achieving hemostasis and allows biomodulation of cells, which causes better healing. So LANAP involves use of a laser with wavelength 1064 nanometer that targets the deceased periodontal pocket. This is followed by removal of the necrotic epithelium, which is stripped from the connective tissue. This occurs at the level of the rete ridges. The connective tissue is spared in the process, and this allows healing by regeneration. LANAP is indicated for treatment of chronic periodontitis, in case of multiple infrabony defects, and in case of periimplantitis. It is noted that LANAP can either be performed as a single-step procedure or can be done in multiple appointments. When done in multiple appointments, it is advised to perform in 1 or 2 non-adjacent quadrants. Coming to LANAP protocol, the step 1 involves giving profound anesthesia to the patient with a local anesthetic agent. This helps in exploring or assessing the pocket depth. This is followed by use of optical glass fiber tip. This is a 316 micrometer diameter optical glass fiber tip. The tip is advanced from coronal direction to the apical direction up to the probing depth of the pocket. It is also called as the first pass. The laser is set at power of 4 watts, pulse duration of 100 microseconds, a repetition rate of frequency of 20 Hz, energy density of 1965 millijoules per millimeter square. The purpose of first pass is to achieve de-epithelialization of the pocket epithelium and killing of the pigmented bacteria. The next step involves scaling and root planing with a piezoelectric ultrasonic instrument. This is followed by blunt dissection to induce bleeding. The mechanism is called as regional accelerated phenomenon. This is followed by the second pass. The laser settings remains the same, however the pulse duration is now changed to 650 microseconds. The purpose of the second pass is to create a fibrin clot which is stable, which allows for soft tissue adhesion and biostimulation of the stem cells. The purpose of fibrin clot is also to achieve enhanced healing. The fibrin clot also prevents the bacterial infiltration into the tissue as well as the epithelial downgrowth into the tissue. It ultimately leads to pocket reduction and new attachment. Advantages of NAP over conventional periodontal therapy are: it is a simple procedure, it is predictable, and is standardized. It is minimally invasive and has a better patient compliance. It causes less postoperative pain and discomfort to the patient. Hypersensitivity is rare. It is less prone to gingival recession, causes accelerated healing and regeneration of surrounding tissues around the teeth and dental implants. Radiographic correlation of NAP. In this image, you can see there is an infrabony defect distal to the second molar. Use of NAP shows that there is formation at 3 months. And also at 9 months, it shows a stable result with sufficient bone growth. So to summarize, LANAP is a periodontal regeneration and new attachment procedure. It is indicated in periodontal defects, mainly the infrabony defects and peri-implant defects. It involves the first pass and the second pass, and the laser used is the ND-YAG laser with a wavelength of 1064 nanometers. The advantages is that it is minimally invasive, causes less discomfort, it is a standardized process, and is less prone to hypersensitivity and gingival recession. You can find the link to MCQs for this topic in the description.
Moving on, I know that was a pretty quick video, so we're going to break it down a little bit in our next slide here. So first you see a pre-op procedure on the far left-hand side. See all those numbers in red? This is before the LANAP surgery. And then as we're going, we progress on. You see those red numbers, which you know red is this is kind of bad. It's like, whoa, we need to stop periodontal happening here. We need to back it up. So then we start going into more black numbers. And this follows that from 2006 into 2019. So you can see where it started and where that tooth is now. If it wasn't for LANAP, that tooth would be gone. The mobility would be unimaginable. And that would also be spreading to the surrounding teeth as well. So I just thought this was such a really cool visualization of the x-rays we would see, as well as the charting that would happen with that.
This next table, it just talks about the lasers that are used in periodontics. So if you would like, you can just review that.
So continuing on with the benefits of laser therapy, I know it was probably said redundantly in the videos, but it is less traumatic than traditional therapy. There is the precision of the laser. Like when they're talking about how big those nanometers are, they are, I think we're working with millimeters with our scalers. They're working with nanometers with a laser. Like that's even smaller. It reduces infection because it's killing that bacteria. It self-seals and lymphatic drainage is so it's just absolutely amazing. It's also stimulating of the surrounding bones and tissues. There's excellent response to the tissues as you've seen. And following an evidence-based protocol and applying the correct laser brings such effective outcomes. And it's only progressing as our technology is progressing as well with some new lasers. There's starting to be more progression for people that maybe didn't have success for LANAP in the past.
So some post-therapy is directly after the laser treatment. You can notice a change in the gum color, some light bleeding and swelling around the area, some soreness or tooth sensitivity, and an unpleasant taste from the mouth rinse that's been prescribed after you're done the laser therapy, just to help with healing and keeping the wound cleaned. Things to consider is that there's also going to be some mild discomfort. You can do saltwater rinses to help with any irritation or use the mouthwash that's been prescribed. Oral hygiene is still encouraged, but in a more gentle manner with a soft manual toothbrush, making sure that you're not causing any more trauma to the gum area. Follow-up visits should be kept to help monitor tissue response or pocket depth reduction if used in a periodontal case.
All right, friends, that was our
Thank you.
presentation. Thank you for listening.
Thank you.